everybody in the country has, if you go down the neighborhood, every fourth house has migraine in there. So it's very prevalent. Well, either they don't go to the doctor to get the diagnosis, and if they do go to the doctor or the nurse practitioner or the provider, they're getting a diagnosis of cervicogenic headache, because like Natalie said, it starts in my neck. So it must be a neck pathology, right? It must be some degenerative disc disease. And then they're also misdiagnosed here, especially with sinus headache. A lot of my speakers are all in Mississippi for the first time. They're wondering why their nose is leaking, and they're sniffling. I said, welcome to our allergies. Yes, yes, take some Flonase. So 60% of the people who would fit the criteria for migraine use over-the-counter medication. They don't even know. Like when I talk to somebody in a taxi car, they don't even know that there is real medicine that's not just for pain in general, but real medicine that's specifically for either migraine or cluster or hemicrania. So that's very important. 39% seek bed rest, but that means that the other 70%, 60% does not. So a lot of people say, well, I don't have migraine because I never go lay down. I push through. Well, a lot of people push through, but if you had a choice, and that pain's bad enough, if you had a choice not to go to your son's game or unload the dishwasher or do the household chores or work, what would you do? So a lot of people push through and have chronic migraine at work every single day, and you're thinking, they can't have a headache every single day, they're showing up at work. But actually, the people who have chronic migraine actually show up more because they know they can't take those sick days, because they have to save them for maybe when their child is sick or save them for something else. But they know they can't take those sick days, at least in this country. You can in other countries. And then the genetic risk, if you have like one parent with migraine, you have like a 40% risk of having migraine, the biology for migraine appear. If you have two parents with migraine, you have a 70 to 90% risk of getting migraine or having that, the DNA for that. And they are looking every day for biomarkers to try to tell us who's a migraine brain and who's not, and why, and what's different about their brain. And then there's tons of money spent each year, not just, everybody says the drugs are so expensive. The drugs are so expensive. There's evil drug companies. But actually the majority of all the medication, the majority of all the money lost, 94% is lost in indirect costs. So that's people not showing up work. So it's lost through the employers, and Tim Steiner is the brilliant one who's been proving that throughout the years. But it's lost by people not showing up at work. And then, do you know what presenteeism is? Presenteeism is when you go to work, but you're functioning at 50% or 75%. You're trying to just be there, and it look like you're working. But that's where we lose lots of money. And it's the #1 complaint in pediatrics.